yesterday we brought you a story about Asian cosmetic surgery tourism, and your response was overwhelming. This is what Louise Cogan from Gorgeous Getaways had to say about the number of failed procedures that her company has dealt with.
It's only in about 1% of patients, yeah.
And how many is that?
We've had about 1,000 patients to date now, so it would be less than 1%. Like it would be, yeah, we've had around about 50 or so.
Well, plastic surgeon Dr. Chris Moss was watching the interview from home, and he was extremely concerned about what he heard. And he joins us now live from Melbourne. Good morning to you, Dr. Moss. Well,
good morning, Lisa.
As you and many others pointed out, 50 is not 1% of 1,000. That's actually 5% of customers who are having problems with plastic surgery. Is 5% acceptable?
I think by local standards, 5% is unacceptable, and from what we're seeing in our practice here in Melbourne, that's just the tip of the iceberg of these problems.
And there are various companies who are offering these cosmetic surgery getaways. Have you seen any clients of these various tour groups coming to you trying to get botched surgery fixed?
Well, I have, and that causes me and my colleagues a lot of concern. I mean, I specialise in facelift surgery and breast implant surgery, so I'm seeing patients relating to those problems for fix-up surgery. I think the most important thing is that this 5% rate or more, these are not minor complications, these are major complications.
So what are some of the more common mistakes that you're seeing?
Well, for facelift surgery, the most common thing that I see is unacceptable scars put in parts of the face and in the middle of the cheek where it's absolutely obvious to everybody. Facial nerve injury, removal of too much skin causing down-pulled eyes, and these are very, very difficult problems to fix. These are not the sort of garden variety complications that we talk about here in Australia that could possibly occur. The other thing is with breast implant surgery, implants that have been put in the wrong position, implants that have been put in such a way that it causes scar tissue to form around them, and infections of breast implants.
And it can be more serious than that as well. I was reading last night that a girl from New Zealand actually died after taking one of the tours.
Well, that's right. I mean, I think that unfortunately you've got to look at the surgical process with these tours. Is patients go over there, they don't get to do research on their surgeon, they don't know the level of their training, they don't get to see what quality implants are going into their body. It may be poorer quality ones that can leak. And the aftercare is not an adequate period of time. I mean, once you hop in the airplane and leave after a week or two, you're not able to get aftercare, and it's well known that that's a vital part of the success of these procedures. And
is that a large part of the point of difference here? Because it should be pointed out that botched surgery, botched cosmetic surgery can happen in Australia as well.
Of course, I mean, there's risks. This is real surgery and it's major surgery, so you don't want to take, play Russian roulette with your health and your appearance. And I think a lot of these people are doing this out of false economy. They're going over there to try to get a cheapy deal, and when things go wrong, it may not be able to be fixed. We can do our best, and we do, but also they may end up having to pay a lot more money than they would have paid if they'd done it right the first time with our world-class surgeons here in Australia, plastic surgeons.
Putting the morality of the situation aside, financially and legally, how liable are these companies to make sure that these women are looked after afterwards? What sort of clauses are there?
Well, of course, they'd have to look at the contracts, and I would recommend stay away. But if you're looking, you might need to see exactly what recourse you do have, and you do not have the medical system and legal system backup that people have in Australia. Once you have a problem, you're very likely to be left on your own. And I think that's why vast numbers of these people are turning to Australian surgeons to fix them up. I think they've been let down.
Well, it is a booming industry. Do you think the government should regulate this, and is that even possible?
I think that would be a fantastic idea. Whether it's possible is outside my field of expertise. I mean, at the moment I'm busy just fixing people up from these sort of endeavours. OK, Dr. Chris Moss, very much appreciate your concern over the issue and your time this morning. Thank you. Thank you. Well, as you can see,
Cameron has joined me in the big chair, so good to have you here.
Great interview, Lisa. The whole idea of linking a holiday to plastic surgery, it's as if it's just another part of the trip, like visiting the Eiffel Tower. It seems to remove the risk in people's minds. It's just going to be a fun, relaxing time away. I think that was a really important message to get across there.
Yeah, and you can see how people find this attractive, because if you are going to go and have some form of plastic surgery or cosmetic surgery, you get the downtime at the other end. People quite often want to hide away from the world while that happens.
That's a big point, yeah.
So it is very attractive, obviously, to a lot of